Welcome, everyone. Thank you very much for making it. This is the workshop on CV, Culture and Trauma-Informed Care, and Validating Patient Support Needs of our TAP CV deep dive that we've been doing. It's also the last in this health series. So today we're going to take some time to celebrate the journey. It's been since April to now. It's almost 5 months. So we're going to take some time to celebrate. So I'll go quickly through the learning goals, and then we will start with the meat of the workshop. Do a small group activity. I think we might just have the group on here be the small group, and then we'll have a closing and celebration. And for those who weren't able to join live, I hope you can still follow along and do the reflection because I think it's useful for us to have some sort of ceremony to really reflect on what you have achieved, what we have all achieved together. Okay. So let's get started. So at the end of this workshop, we are going to have spent some time reflecting on the impact of culture and trauma and trust in healthcare interactions. We're going to practice, very importantly, practice the trauma-informed approach that we went into in some detail last week. I will review it again because we need it to be able to do today's work. And then this is the final session in this series. So we're also going to take a moment to celebrate and reflect on the journey. Okay. I'm going to very much miss these times that we've had. All right. So now shifting gears, we are focusing on culture and trauma-informed care and how to use it. So I'm going quickly through the framework that we went over during the training last week. I know there's the recording, but I also know that, yes, I also know that we may not have had time to review it. So because you need this for today, I'm going to go through it. We took the CDC, again, always want to make a reference to some higher authority. This framework comes from CDC and SAMHSA. And we adapted it to the context of AN communities. So these 6 principles, if you need to flip back to the presentation from last week, but we talked about each, and I will talk a very high level about what the practical tips we talked about each were. Before then, though, I tend to use mnemonics a lot to try to remember frameworks. And I say try because you'll forget, but it's okay. And this mnemonic here, very handy mnemonic to help remember these 6 principles. I love it, the beginning of it, which reminds us that it's always a process, right? So safety takes practice, collaborate to empower culture. This is a mnemonic to help remember the trauma-informed approach. The safety is for safety, which we spoke about, physical safety, making sure you're talking or interacting with people in a space that they feel physically safe. But not just physical safety, we talked about emotional safety, psychological safety, letting people feel free to express themselves, having a sense of social safety, bringing warmth and a sense of belonging to the interaction, and then also talking about shared values. So these dimensions of safety, we went into detail last week. I just want to highlight them for you today. The takes in the safety takes practice is to remind us about trustworthiness. So T for trustworthiness and transparency. And that's about showing up with consistency and integrity. People can tell when you are putting on. Something just doesn't feel right. They may not know exactly, but whatever it is, show up with consistency and integrity. Speak clearly and honesty. We went into detail about that last week and acknowledge history and their experience. Peer support, the P in practice to remind us for peer support, which is about allowing people to or making peer connections possible wherever possible in the interaction that you are facilitating. And if you yourself are not quite a peer in whatever it is, still showing up with the spirit of peer support, right? Which is humility, warmth, and non-judgment. It will be one place. Also, importantly, we talked about respecting people's preferences for peer support. People may not want you to put them in touch or may not be ready, so respect that. For collaboration and mutuality, it's about giving a chance to have some reciprocity in the relationship. Share stories about your own learning, give them a chance to help you in some way, to give to you. When you are receiving all the time, it may not feel quite as a, a full relationship, right? So create those ways in which people can give to you. Use language around mutuality and collaboration instead of saying things like you must or you should. It's we, because truly anything that is going to get done is going to take more than just one person to do, right? So where it's relevant, we. And empowerment, voice, and choice, making sure that you are hearing people, giving them choice, even if it feels small in whatever situation is. And then on this cultural and historical issues, we spent quite some time. It is really allowing and acknowledging people's history, respecting people's identities that they want, their preferences, even pronoun preferences, the way you talk to them or refer to them preferences. So this is a very high level. I wanted to at least review it because what we're doing today is going to call on us to know or remember, if you've had a chance to look at it, this framework, right? So try and see. I don't know if this is helpful, but personally, I find mnemonics helpful to remember things. And in this case, this mnemonic, safety takes practice, collaborate to empower culture, it's in itself is giving a message that is useful. All right, so that was a crash course on last week. Now we're going to do the part where you need to do the work. This is what makes it a workshop. So here is a grounding reflection. And I would ask that if it's possible, if you are feeling comfortable, come off come off, turn on your video so that for at least for the small group activity, you are seeing each other because we are going to be the small group. I had a plan to put us into small groups. Actually, there's about 10 of us. We still can do that. Okay, so we'll have two small groups. For this grounding reflection, though, the goal is to reflect on a healthcare experience that felt good. But now that we have this framework, we want to identify which principles were in place, right? So the exercise that we're going to do individually, and 10 minutes seems like a long time, but it isn't really. Think of a healthcare interaction, yours or someone you know, that felt positive. It could be clinical, it could have been community-based, it could have been you receiving versus you giving. What I'd like us to do is to reflect on the experience and ask yourself what principles were in place. Now that you have a framework, we're trying to dig and see what made it feel good. Okay. And then we take a few moments to write down your reflections in the chat. This is something that we will do individually. I can give you a very quick example here just to make it tactical here. And I did this exercise myself when I was putting it together. So my story is around an interaction with a neonatal care specialist when I was pregnant with my second daughter. She actually turned a very scary diagnosis into something that I think about with warmth. So thinking through the principles, took each one by one. For safety, I realized that she took me out of the scan room where there were all these beeps and these machines. She took me to her office, which had a carpet. I remember the carpet and a lamp and pictures on the wall, and it just felt really good. She sat down, she was at eye level. She told me truthfully, there's something showing up on your scan. She didn't try to hide anything. And I felt that she was coming in very genuinely. And then for me, peer support was also important because she told me that I could call her anytime, which is rather crazy. But I think one of the reasons she did that was she really spiked on this cultural, seeing me culturally, because she happened to be a Black woman from West Africa, like I was, and she asked me what I was eating. And that alone just made me feel very seen, right? So this is just a short recap of my interaction, but the exercise you're doing here is take something that felt good, pick each of the principles, and then take a moment to reflect how they were demonstrated in that situation, right? So you will then share in the chat, and then I will ask if anyone wants to share their story out loud with the group, we can do that. But the purpose of this exercise is to see how cultural sensitivity and trauma-informed care being present made something feel good, or not necessarily good, feel like a positive interaction. Okay. You can take about 5 minutes, and we'll come back.
BB, what are we supposed to be doing?
Oh, sorry. This is it Teresa?
Yes,
Can
this
you,
is Teresa. I know
you,
you asked a question, but
yes.
so
Can
you're
you,
just waiting for a response?
yes, I'm waiting for you to reflect and then put in the chat
Okay.
the thing. Yes. So do you see the screen with some of the guidance here?
Okay.
Yeah. Reflect on, pick something and then reflect on which of the principles were in place. Something that felt positive, I should say, right?
Thank you.
Mhm. Okay. I see we have several stories here. Um, Dr. Alithia, I can share aloud. I can read aloud. Would you like to share with the group your story? She sounds wonderful, this provider.
Yeah, I actually saw someone this morning right before this meeting, and it was a really positive interaction. Some things I liked were like the clinic and her office were like, I think physical space is really important, so I'm glad you brought that up. But like, it is good to really convey a sense of like the space being, because it's not just about it looking nice, it's more about feeling safe in the space, probably is a really good way to think about it. And so, um, the space was very like clean, well maintained, comfortable, warm, inviting. Just like you're mentioning, there's some like art on the walls. And then the provider was just like very, very warm and very collaborative, making a lot of eye contact. And then I thought she gave this great example where she also told me up front, if I um, come up with a plan that isn't like realistic or doable for you, please, tell me. And she said, sometimes providers might make like assumptions about their patients. She said, for example, somebody might assume that I, meaning herself, could run 5 miles, but I definitely can't. And so she was like, if, someone came up with a plan for me that I was going to start running 5 miles 3 times a week, there's no way that would ever happen. She was like, please tell me right away if I'm making a plan that is based on assumptions or it's not realistic or it's not doable for you, because I want this to be something that like works for you and is collaborative. And so I thought that was really, really great.
Yeah, thank you so much for sharing that. So if you see in there, she was giving you voice and choice right away. And in including you in the planning, there was collaboration, right? So we can see several of these principles were at play. Sometimes we don't even know why does this feel so good, but it's because we have to be intentional about it. It helps to pull out why something felt good like that, right? So we have, at least for Dr. Lithia's interaction, there was safety, there was collaboration, mutuality, empowerment. And then Lucinda mentioned something which I think was very interesting, which is it was a diabetes. Actually, Lucinda, do you want to share? I can also share out loud if you'd rather not.
Sure. Um, this has been a while. It has been I worked with the diabetes education program, and when our target population began to change a little bit more to the elders and trying to work with them, we began to engage the nutritionists. And one of the in our discussions was, when I go home and I make bread or I make the dough for for tortillas or bread, we're using our hands. My grandmother, and I'm sure everybody would agree to this, is we don't use measuring cups. We don't use measuring spoons, but using your hands to, cup the flour or the salt and baking powder. So that became a new project in itself. Was how do we work on doing that? And because of that, a lot of our IHS pictures are now coming or have been with using the hands. This is the size of the meat you should be eating. Um, this, if you break your hand, looking at your hand, certain different measurements came out of it. So it was a really great project, and I think that it still serves us well today.
Thank you so much for sharing, Lucinda. And it is particularly striking because on the face of it, it doesn't seem like you are being culturally sensitive or trauma informed. But when we talked about safety, one of the safety was social safety, which was using images and inclusive uh, ways of sharing information. And if you never use cups and everything is in cups, you probably already feel left out, right? So changing that imagery from cups to hands is a way of saying we are part of the same group. We understand you. And then, of course, is also checking the cultural identity because you are respecting that in actually in my tribe, no self-respecting person cooks following a recipe. You would never measure a cup or something. You'd be like a little bit more, or about a handful or two handfuls. Those are the measurements. So that's a really impactful story. It's so fascinating to me, personally, to see some of the similarities across the the way we do things in West Africa and what I hear you share, right? And Gary, can you talk a little bit about your story? Always safety seems to be coming into play across all the stories here.
Yeah, it was just an interaction that I had with this lady, and she was actually just she was a triage nurse before the actual provider came in, but she she did a lot of that. Like I felt comfortable and safe. Just the just her warm voice created that trustworthiness, and she opened up about where she was from, but also just the her presence of being in the veterans clinic in Flagstaff as a Native American woman. It was kind of cool because typically Flagstaff's just a lot of Anglo folks in there, so it was nice to see that. And so there was a lot of that connection in that. When I mentioned that I was from Hopi, and she said that she used to work here, and she asked about certain people, and it just opened up doors of like, okay, yeah, there is this still going on? Do they still have this? Is there a Hopi 100-mile club still happening? I said, yeah, there's all kind of runs going on right now. So that was just a really nice reassurance that I felt from her. Um, and it was a meaningful conversation, so much so that after my appointment, I went back. She went back and gave me her contact information. Said, "Hey, I got kids and stuff, and we want to go back out there. So let us know when these big events are coming up." And so I think I still have her contact info, but it was just, yeah, the door was wide open, and she was open to sharing what she had to. She had a lot to offer, and I was just there for a checkup, routine checkup. So it was nice. It was a quick, nice visit with her.
I mean, what I'm hearing stick out is the neutrality. She actually gave you a chance to share. It's funny that you talk about her sharing. She gave you a chance to share so that she could receive those updates on information and put you in a position to actually give to her. And that in the end seems like it made you feel good, right?
It
That
really did.
that reciprocity is important across all relationships. And one of the strangest things is the more you give people a chance to not just take, but also give back, the more you make them feel better. And in this way, she allowed you to give her stories and information. So that neutrality and collaboration, really, that's what comes out in that story for me here. And then, oh, Dr. Paula, please definitely talk about this story to us if you don't mind sharing.
Yes, thank you. Thank you, doctor. And I think similar to Gary, I think it was the initial interaction. Um, again, feeling safe, feeling that, the approach was validated with not just, can I help you? It was, good morning. How are you today? And so I instantly felt safe and was able then, like you said, sometimes it's an opening for us to give, right? And then so it reminded me as an elder how I wanted to react to the or engage with these two young women who were very attentive, and they knew that I had driven a few hours to get there, and they asked about my drive in. But I was able to offer the same to them, wanting to know genuinely, how their morning was going, and then thank them also for getting me to where I needed to go. So I think that first piece, that safety piece, really nicely paves the way, um, through this process. And I think to some extent, um, it's a little bit sad that because of having some negative experiences with healthcare visits, that this one stood out so beautifully, right? It kind of reminded me of how a positive interaction can really, um, like I said, I would go back
Yeah.
regardless of what the pain level was going to be at the dentist. I felt safe there, and I felt that they wanted the best outcome for me, and I think that really is therapeutic in its own sense.
Mhm. Thank you for sharing, because when I noticed you said a couple of hours to go and see a dentist, I mean, you can imagine that that is not necessarily the top of mind of something that would feel good, having to drive hours to access a dentist. But it sounds like there was that, first of all, the physical safety, but also emotional safety that they met you with, right? So as we are talking,
Absolutely.
it seems like
Mhm.
there's probably a reason why in this framework, safety is the first one and is the foundation, right? Safety takes practice.
Right.
And we are hearing through all the stories that having people feel first safe is then the foundation for you to even have a chance to be honest and transparent with them, to give them a voice and a choice. And it starts from all those types of safeties, the emotional, social, and the physical, obviously. So Taryn, you have an interesting story. It's one of the great aspects of having a multidisciplinary group have this discussion is you can see how this framework works across various types of settings and how these guidelines can be demonstrated, right, in any setting. Taryn, can you share with the team what your experience is?
Sure. I think this one example falls in line with number 4, collaboration, mutuality. But I think, we did a lot of planning for our conference that was held last week. And it involved a lot of partners, but I think as it came together, you could see all of the pieces fit together. We had, cancer survivors share their stories. We had their caregivers talk about and share their stories. And we had cancer care centers, talk about what they're doing and how they're trying to work with all of our tribal, urban, and IHS partners, and getting a feel for what's happening and trying to, bring to bring more awareness, that cancer care is important, and we need to find funding and that sort of thing. But just got a lot of good feedback from people as far as the planning went, and there was that intimate space where people got to share their stories and really hear firsthand from the participants who were there. And then even the agenda, we had some awesome presenters who we just covered a lot of different aspects as far as inviting presenters at all levels. So I thought that was really great, more on
Yeah.
the larger scale.
And what I hear is beyond the collaboration and mutuality, peer support. You facilitated those peer connections by having the survivors come and speak. You must have come forth with transparency and trustworthiness, because I'm sure the stories weren't all rainbows and roses, and that gave people a
Right.
sense that you were being genuine and sincere, right? So they link through each other, but it's interesting, even for something like a conference planning, if you take this framework and think through each of the principles, am I doing something that is going to and show peer support? Then you may make you look at who is coming, who is sharing their story. Are we being balanced in the story? That gets the trustworthiness. And of course, the safety, we've seen that's very important. And even the empowerment, voice, and choice, having people have a chance to say what is working, what is not working, what types of care they may want to see. I do not doubt that you recognized you didn't recognize the cultural and historical. This is what you do. I mean, this is why we are here. So I'm sure that was in place also. So thank you for sharing that. And then Teresa, you shared a story about a mother. Can you share that with the group?
Sure. It's a while back ago as well. Taking my mother in for her appointments, and the provider was very understanding of her choices, of not really seeking the full medical care for her kidneys, and respecting her because she believed that, you know, that she didn't want to go through dialysis. And Yeah, it was her choice to, you know, just with that.
Yeah.
And
Yeah.
continuing
Empowerment.
to give us, yeah, continuing to give us resources. But it was just a good experience that the provider understood my mother and respected her decision.
Thank
So
you.
yeah.
Thank you very much for sharing that. Yes. And in a way, by giving empowerment, voice, and choice, you are also allowing for collaboration, right? Because once you hear that they have made a particular choice, then what do you do together once they are on a certain path? So thank you so much for sharing that story. So this is what I wanted us to do this to think about what happens when it goes right, because we know more than often some of these principles are nowhere in sight of the actual health interactions, as we saw, like we've discussed, why there's a lot of trauma and trust, especially with people having experienced, and this, sorry, I mean within AIA and communities, having experienced and anticipated poor health interactions. So with this foundation, we are now going to do our small group activity. We are small already, and I think we should just stay as a full group over here. So I won't do the breakout session. What we will do is consider all of us into one group. The exercise here is to reimagine a better story for some interaction that was not as positive. And how we're going to reimagine the better stories, we're going to take one story, and because of time, I will suggest that I will just ask someone to give us a story that we will take together as a group, and then go through each of these principles in an intentional, methodical way to say, if safety was top of mind for the whatever the setting was, what could have been in place? If trustworthiness, so on and so forth. So we're going to brainstorm principle by principle what could have made this story a better story. Is that guidance clear? Right. So here, now imagine that we are in a breakout room, and I would please ask if you can to put on your videos so that your team members, which happens to be all of us right now, can see you. We can go around and share a brief story of something that didn't go right. But before that, let me ask, does anyone have something that they'd like to propose so that we can just skip that step? And please do come off mute at this point. This is a group interaction. I know this format is not the best for a workshop, but we're going to do it. Any interaction, it could be clinical, non-clinical, it could be around an education, event, anything like that. Take a moment to think about it.
One thing that always jumps out to me is always like the provider coming in and just what's going on, what's this, let's get into meat and potatoes of what's going on, and I don't have much time. And what's your primary complaint here? And no, that's not what but I also have this. What about the patient not having other things, but then the provider not having enough time? Can we go into that?
Okay, so do you have some, I mean, that happens all the time. Is there a specific story that you had in mind who it was? Has this happened to you
I just remember that from our session over in when we're
in DC?
in DC,
Yeah,
Baltimore, yeah.
yeah. Thank you, thank you. That's we can use that. Um, Let me see a specific one. I remember Emily shared a story last time, maybe not week, about how she was a kindergartner and had to translate or essentially take her grandfather to an appointment and the grandfather didn't speak English. So that's a very specific thing that was like, oh, there are many opportunities here that we could write a better story around. If anyone doesn't have another story, we can use that specific one. Should we go for that one? All right. So unfortunately, Emily's not here, but she shared, so I'm sure she's okay with it. The story she had shared was when she was younger, her grandfather, who didn't speak English, maybe he spoke only Navajo, and they had to go to appointments, and the provider would explain these complex things, and she, as a kindergartner, would have to try to explain to her grandfather. So of course, her grandparents did not trust going in, and she said she was very nervous as a child that she was probably making mistakes that she could end up hurting her grandfather. So that's the context. Let's take each of these principles and see how we could have written a better story, right? So first, for safety, and don't let me do all the work in here, right? Think about safety. We talked about safety. There were many dimensions of safety. If we're thinking about the safety principle, what could have been the better story around this interaction that Emily's family had to have?
I think they could have asked for an interpreter.
Right. I have a sense that there wasn't one present or available. But the better story is that there are interpreters present, right, for families who need it.
Yeah, I worked in a behavioral health clinic, and interpreters weren't always available across the hospital, but I knew of our own staff who could speak Navajo fluently, and I would usually ask those providers to help me or to help our patient, and they were more than willing to do so. So, I think uh, providing those instructions in the native language really
Mhm.
helps, especially when you're seeking special care or even new type of care. Because the instructions are very specific. They may not always understand, why we're asking for specific answers or questions.
Yeah. So the better story, well, the best story would be to have um, trained interpreters available. But the better story is that even if the interpreter is not there, they find someone and not put the interpretation on. She said she was kindergartner. She may not have been more than five or so, right?
Yeah.
And if you have, I would take everything a 5-year-old is saying to me with a pinch of salt. So we can see that the trustworthiness and the transparency was also not in place, at least for the grandfather. So we can say tied into the creating trustworthiness and transparency, having an interpreter there was critical for that interaction. And in terms of peer support, you can imagine that he, as an elderly non someone who didn't speak English, he would not have been the only one going in to see that provider with that without having that language. So making the connections to peers would have been another thing that either the provider's office or the provider could have taken as part of being trauma informed in the care of elderly who did not speak their language. And I think in that example, Emily's example, once you did not have the safety of even being able to understand the provider, everything would fall down, right? It's going to be hard to create opportunities for collaboration and mutuality if the patient cannot understand what the provider is saying. Choice and voice is probably also going to fall by the wayside. And I think it is quite an affront to serve a population and not even have someone who speaks their language on hand. So the culture and respecting their history was also not in place, right? So, I mean, this is like unfortunately, the very first step, there was a break. So everything then fell from there. But in that example, if we were taking each of these principles to write a better story, we could see many, many opportunities for improvement, right? The first would be having that safety. She didn't say anything about the physical space, but or the emotional space, but you can see, you can surmise that if you're going in there with a young child being the one to translate for you, you're probably not feeling very psychologically safe or socially connected. So a better story would have been to have established that safety, and that would have run through all of these aspects. Okay. So I encourage you, we have time maybe for like one one more story. Even if you are not going to share, what I'm trying to push you is to think through how these principles can be demonstrated in different settings to improve the situation, right? Um, Dr. Alethi, I'm going to pick on a story that you shared all the way back in April about you had sent, you realized that one of your patients couldn't read, and that's why he was missing all those appointments. So if you were thinking, and you actually noticed that, which in itself is a win, because then we can do something about it. But it suggests that if a provider wasn't being as conscientious as you were to see that really you need more in that way, peer support and ways of getting him to even know when his next appointment was, that would also have persisted in whatever his health challenge was, right? So looking at the framework often forces one to think in this dimension, what may be missing, right? You can't have trustworthiness and transparency if the patient doesn't understand you or doesn't is not even able to show up for the appointment. Okay. So any thoughts or reflections on using this framework? This is something that has been used across many different scenarios, right? I didn't build this, but what we are working on is adapting it to the various settings in which you work. Okay. All right. So we have about 15 more minutes left in our time together in this series. I wanted us to, oh, Dr. Alethea, really?
Yeah, yeah. So I didn't notice either. And it just came up because I was going over with the patient what was going to happen. He was asking a lot of questions about what would happen when he left the hospital. And I was like, you're going to be, because he was going to be on IV antibiotics for like 6 weeks. And I was like, you're going to come in once a week and get the dressing changed on your long-term IV line. And you'll see me once a week and you'll see the foot doctor. And you also have to, get blood work done once a week to monitor the antibiotics. And he kept asking, like, what day am I coming in to see this person? What time is it? What day, what, and I was like, don't worry, we're going to get this all printed out for you when you are ready to leave the hospital. You'll have a list of all your appointments. And he just was like, well, I can't read. And I was like, oh my gosh. And then I realized that like, because this was not the first time that had come up, like leading up to the thing that caused the hospitalization, leading up to the hospitalization was because he was like, people were sending him letters in the mail with appointments or trying to give him printed materials about diabetes or think like people were doing all these interventions with him that were all printed material. And it just never came up before. And he just had to tell us, finally. But like no one had ever asked before, like everyone had made assumptions. So it was really eye-opening.
Yeah. So I think I'm so sorry. He wanted to be heard. So I think in that situation, what do you think a better story could have been?
I think if we had, like, it should have been pretty obvious. I mean, even if we didn't realize that he couldn't read, like, it was pretty obvious he was like missing appointments and not, we weren't engaging well, him with like what we were trying to do in terms of, diabetes, management and things like that. And so, um, actually like it actually comes full circle because I guess that thing that the provider this morning said to me about not making assumptions. And she was like, some people might assume that I can run 5 miles, but I can't, um, we could have approached it with, like sometimes we make assumptions that, people can do certain things and that's not realistic for them or not doable. And maybe being like, what isn't realistic about this plan we're doing? And then he might have been like, well, the problem is I don't know what my appointments are because you keep sending me letters and I can't read them. So that would have like gotten to it really quickly. But I think because we never elicited it, it took him to finally be like really frustrated, to finally bring it up. We just never asked.
Right, right. I think this goes back to this, even though it's a mnemonic, it takes practice, right? You can't fully anticipate all the ways in which you need to continue to be thinking and to be sensitive to people's needs. And yeah, one thing, I guess, asking and not making that assumption. But thank you very much for sharing that. That is a very growth-minded approach that you caught me in that and actually shared that there was something that could have been done differently. So we're now just 10 minutes on to the end, and I wanted us to just take a little mini ceremony for us to celebrate our journey. I looked back on this and I said, whoa, we have actually done a lot. We've done a lot. We did this 1.5 days, so this is just to capture everything that we've achieved. 1.5 days, we went through definitions, we talked about some disparities, we discussed some practical interventions, right? And then you did the campaign, I don't know if you remember with the pictures. And then we've had these deep dives, trainings, and then workshops over 4 months. So you've actually along come along with me in this journey of sharing, and you've shared a lot back with me. I have learned so much from our interactions. And I was thinking of what have we actually gotten from this? So this is a very busy page because we've done a lot, right? We have frameworks, many frameworks. Even TAP CV was a framework. Safety takes practice, this new one, the framework. I try to put out frameworks that you can call on to remember some of the dense information that you have, right? And it's always going to take practice. But we also have friendships. And I mean it genuinely when I say I'm going to miss this time with you. I'm going to miss chatting and learning from you. And I hope you've been able to make friendships across the various IHS areas also. I know that actually. You've shared some of the stories. We've done some reflection, right? And over here, I used the pictures because I wanted to remind you of your beautiful campaigns that you put together in such a short time, but are actually real campaigns that you could be using. We've learned some research. I have found it very powerful to look at the data aspects of things also, right? We needed both the reflection and the research. Some people respond. I think it was Emily or Megan who was saying that she was sharing some of the information with colleagues, and they were like, "Well, what's your source?" And she had a source because we have everything we've done has been founded in research. And then also we've seen resources. And in sharing these resources, I myself have been reminded of some of the resources that I had forgotten. especially like resources of where to put pictures, because I was thinking, Dr. Alithia, as you were talking, what if there was either a picture or a video based or even a voice message that could have been shared with this gentleman about when his appointments were? The way to communicate goes beyond the printouts, the copious printouts that we often get, right? So this is I just wanted to put in front of you as a reminder the journey that we've taken, some of what we've learned. I want to remind you that we have come on a journey all the way from April into now. And let me see, I also wanted to share with you something that is a little bit of homework for you to do. And this is just one learning. I would personally appreciate you, and I'm sure you would like sharing also. Commit yourself to share just one learning from this series. So pick one thing that has resonated with you, and for a moment, plan who you are going to teach it forward to. Set that intention of who you will teach it forward to. So let's take 30 seconds because I want us to actually do this. And I'm going to do the exercise with you too. Right. So do you have your one learning that you will share and who you are going to share it with in mind? Okay. Right. So with that, this is our final session. I wanted to say thank you. Many voices, but one message. I hope you see your greeting in your language here. I actually put thank you in my language also here. It means medase. Medase means thank you. Um, I would love for anyone who sees their greeting here, or who, if you don't see it, I'm so sorry. This Google did its best for me here. But thank you so much for your dedication and your your ideas and for all that you've shared. Thank you so much for your enthusiasm and for your jokes and for your openness in sharing everything with the group here. And I hope you will teach it forward and pass it forward to at least one person. Okay. Thank you so much, Dr. Paula. Thank you so much. Okay. Miigwech, did I say it right? How do you say it?
Yes, yes, you did, doctor. You
Miigwech.
did
Oh,
it perfect,
yay.
right? Big wedge.
Wonderful. Thank you so much. And Gary, did I get you or not? I didn't get you.
Hopi's not on there, but in Hopi we say for male it's kwakwa.
Aqua?
Yeah, and for female it's esquale.
Esquele, esquele. Thank you so much. And in
Medase.
Medase, Medase, that's my, and Ahehe. Is it, how do you say that? That's Navajo. Do
Yeah,
you have Ahehe, Ahehe,
yeah.
Ahehe, Ahehe? Okay, so I'm going to let you go. I will beg you to take these final 2 minutes to do this final evaluation. I appreciate it so much, and you really have been very, very helpful and insightful throughout, and that has made this series what it was. Let me put the link in the chat. If you haven't had a chance to scan, please do so.